Various organizations are doing patient satisfaction surveys, asking questions of patients about our relationships with them as providers or our relationships as clerks and receptionists. This feedback, again, can be a little disturbing, but it's what we need to know. What is the perception of our patients in relationship to their experience in our office? Well, okay, we have a lot of reports that are worrisome, and I think we all agree we'd like to do a better job, but we're dealing with some very difficult problems, and none of these Ds were on the list of subjects that I studied in medical school, or frankly, an internship and residency. Looking for opportunities to identify and support health-seeking attitudes and behaviors turns out to be the response we need. I keep remembering for myself how I used to get angry at patients who would come in looking beautifully groomed and appareled, but they're not taking their medications, and I began to feel about them that they weren't interested in their health. But when I looked at those nails and I looked at the hairdos, and I looked at the smart shoes, I began to realize, well, what is health? Health is the attempt to look and feel good. And so these people were, in fact, seeking help. They were seeking it in a different way, or a different starting point than I, as a doctor, would recommend. But we could find common ground here. We could say, I can see from the way you take care of yourself that you're really interested in your health. Let's talk some more about what other things you can do to make sure you stay healthy. Now, a lot of you out there remember the way we used to learn or try to learn. We would be given prescriptive information, and then we would be told what the consequences were. As learners in medical school, this was pretty frightening. As a patient, when someone tells you that you could have a stroke or a heart attack this week unless you take your pills, that was kind of the way I was taught to motivate patients in the past. This, of course, creates a reaction which can be damaging. Now, let's see what happens when we use the old method. Well, that patient, as you can see, that parent feels ashamed and incompetent, and she probably feels a bit abused. And I can tell you from the provider's point of view, it doesn't feel good there either. You leave the room realizing that you may have actually damaged a relationship, that the chances of that person being able to move forward based on that conversation are pretty small. And you don't even feel very good about yourself.